Hi CJ, my name is Kelly and I'll be your nurse today. I'm going to shut the door, lock the bed in place, and also wash my hands. I gathered my stethoscope, thermometer, and also my blood pressure for our exam today. Can I ask you what your name is? And also your date of birth. Perfect, that matches your wristband. Are you experiencing any pain today? Do you remember my name and your name? And do you know what month it is? And do you know where you are? So now I can say that he is alert and oriented ×4. And just so you know, anything that is said today, as I am required by HIPAA to keep in confidence. And first, let's check your blood pressure. I'm going to put this arrow over the brachial artery. And up here. I'm going to put the sphygmomanometer at heart level. I'm going to stick my stethoscope over the brachial artery using the diaphragm and pump this up about 30 millimeters of mercury above normal. And then once that's pumped up, I'm going to slowly release it 2 millimeters of mercury at a time. And then the first sound I hear is systolic at 120. The second is diastolic at 80, which is normal. Next, I'm going to check your radial pulse. And we are going to check both to make sure that they are equal for 1 minute. Good job. And now we're going to check your temperature. I put this covering over it. Please open your mouth. Yeah, it's gross. No, it's not food. And we're going to wait until it beeps. Beep. Good job. It's 97.8, which is very normal. And now I'm going to count your respirations for 1 minute. So just breathe in and out very normally. He looks very relaxed. He's not guarding. His respirations are normal. His skin color looks normal for his ethnicity, and I don't see any lesions or rashes off the bat that seem alarming. And now we're going to see if I can have you lean forward. I'm going to check the point of maximum impact, which is in the mid-clavicular line in your 5th intercostal space. Good, so if you can lean forward or backwards, lean forward on your belly. Good, that sounds normal. I don't hear any rubs. And now I'm going to look at the 5 different points of his heart. The first is the aorta on the right side, in the 2nd intercostal space. And of course, this will be directly on skin. Next is a pulmonic, directly across in the 2nd intercostal space. Next is the tricuspid in the 3rd. fourth is the mitral. And the fourth is the tricuspid, and the fifth is the mitral, which is in the fifth intercostal space in the midclavicular line. And the heart sounds sound great. Next, I'm going to check his carotid. First, I'm going to palpate it. It feels normal. And now I'm going to listen with the bell side of the stethoscope. Good, so you now take a deep breath and then hold your breath. Good, and breathe again. Perfect. The carotid sounds good with a 2+ sound and strong with no revs or any crackles or no rubs. And now, Sage, I'm going to check your lungs. I'm going to check 5 spots, left and right anteriorly and also posteriorly. Good, and I'm going to check the same 5 spots posteriorly. Good job. No cracking or wheezing. Everything sounds normal. And now, Sage, we're going to check your upper strength. You could press up on my hand, and down on my hand, and then push my hand away. And the same on the left side. I'm going to check your capillary refill time. Good, it's under 2 seconds. Next, we're going to check the strength of your lower extremities. So, Sage, if you can, push my hand up, push my hand down, push my hand away and towards the body on both legs, and then flex and extend the foot. And then you want the patient to push their knees together and push their knees out. Next, I'm going to check the posterior tibialis pulse, which is right here, and also the dorsal pedis pulse. I'm going to check both feet to make sure they are both equal and reactive. And Sage, you look good. I didn't see any skin lesions. Sage, we're also going to check your eyeballs before we call it a day. If you can look at my pen, you're going to keep your head straight and follow my pen with your eyes. You're going to look up, down, to the side. Good job, bud. Now I'm going to turn the lights off, and you're going to look at that picture while I shine the light into your eyeball. Good job. Now look at my ear and back at the picture. His pupils are equal, reactive, and a accommodating to light. And Sage, if you can open your mouth for me. I'm going to look at his gums and his tongue to make sure there are no lesions. And his gums look nice and pink. Good. And throughout this whole process, he is alert and oriented. His speech is smooth and clear. He hasn't been guarding at all. He seemed comfortable. So, Sage, do you have any questions or concerns about the assessment today? No? Okay. I'm going to lock your bed in place. Here's your call light if you need anything. And we'll go outside in a minute. Good boy.